Hello, future RNs. Welcome back. Today, we're diving deep into two vital electrolytes, calcium and magnesium. These aren't just numbers on a lab report. They are critical players in your patient's heart, bones, nerves, and muscles. Let's go. 1. Calcium, Ca2+. Calcium is the superstar mineral. 99% is locked in your bones and teeth, and the remaining 1%? That's the part that keeps your muscles moving, your nerves firing, and your heart beating in rhythm. Let's break it down. Normal serum range, 8.5 to 10.5 milligrams per deciliter. Functions. Bones and teeth provide structure and strength. Muscle contraction, skeletal and cardiac muscles depend on calcium. Nerve conduction. Calcium allows neurotransmission. Blood clotting, essential for coagulation cascade. Factor 4. Enzymatic reactions. Activates multiple enzymes in cells. Regulation. Parathyroid hormone PTH increases calcium by mobilizing from bones and increasing renal reabsorption. Vitamin D, calcitriol, boosts intestinal absorption. Calcitonin lowers calcium by inhibiting bone resorption. Causes of imbalance. Hypocalcemia, less than 8.5 milligrams per deciliter. Hypoparathyroidism, low PTH. Vitamin D deficiency. CKD, phosphate retention binds calcium. Acute pancreatitis, fat binds calcium. Sepsis or critical illness, tissue redistribution. Hypercalcemia, 10.5 milligrams deciliter. Hyperparathyroidism, excessive bone resorption. Malignancy, bone metastases, or PTHrP secretion. Vitamin D toxicity, excess absorption. Thiazide diuretics, decreased excretion. Clinical signs and symptoms. Hypocalcemia. Neuromuscular, tetany, carpopedal spasm, Kvostex and Trousseau signs. CNS, confusion, irritability, seizures. Cardiac, prolonged QT interval. Arrhythmias. Others, numbness, tingling in fingers/lips, brittle nails. Hypercalcemia. CNS, lethargy, confusion, coma in severe cases. GI, constipation, nausea, vomiting. Renal, polyuria, kidney stones. Cardiac, short QT interval, arrhythmias. Musculoskeletal, weakness, bone pain. Nursing interventions. Monitor calcium levels and trends. ECG monitoring for arrhythmias. Encourage calcium-rich foods, dairy, leafy greens, fortified products. Administer IV calcium, calcium gluconate, in severe hypocalcemia. For hypercalcemia, hydration, loop diuretics, bisphosphonates. Treat the underlying cause. 2. Magnesium, Mg2+. Magnesium is the unsung hero. Think of it as the muscle relaxer of electrolytes. It keeps your muscles calm, your nerves stable, and your heart rhythm smooth. Normal serum range, 1.7 to 2.2 milligrams d-liter. Functions. Neuromuscular, regulates contraction and nerve excitability. Cardiac, stabilizes heart rhythm, cofactor in Na+K+ pump. Metabolism, cofactor in greater than 300 enzymatic reactions, ATP production. Bone, stored in bones, 50 to 60%. Electrolyte synergy, low magnesium, hypocalcemia, and hypokalemia. Causes of imbalance. Hypomagnesemia, less than 1.7 milligrams DLL. GI losses, vomiting, diarrhea, malabsorption. Renal losses, diuretics, aminoglycosides, cisplatin. Alcoholism, poor intake, plus renal loss. Associated hypocalcemia and hypokalemia. Hypermagnesemia, over 2.2 milligram DL. CKD, decreased excretion. Excess magnesium intake, antacids, laxatives. Iatrogenic, IV magnesium therapy, preeclampsia, asthma. Clinical signs and symptoms. Hypomagnesemia. Neuromuscular, tremors, tetany, hyperreflexia, cramps. CNS, irritability, agitation, confusion. Cardiac, arrhythmias, torsades de pointes, prolonged QT. Often coexists with hypocalcemia and hypokalemia. Hypermagnesemia. Neuromuscular, muscle weakness, decreased reflexes. CNS, lethargy, drowsiness, coma in severe cases. Cardiac, hypotension, bradycardia, cardiac arrest. Respiratory, depressed breathing. Nursing interventions. Monitor serum magnesium levels and trends. Assess deep tendon reflexes regularly. Monitor ECG for arrhythmias. Educate about magnesium-containing medications. Treat hypomagnesemia, oral magnesium or IV magnesium sulfate. Treat hypermagnesemia. Stop intake. Administer calcium gluconate. Consider dialysis. 3. Calcium and magnesium interplay. Here's a golden nursing tip. Calcium and magnesium are like dance partners. Low magnesium can cause low calcium because magnesium is needed for PTH release. So when treating hypocalcemia, always check magnesium. Treat both if needed. Nursing mnemonic. Mg calms the nerves. Ca moves the muscles. Magnesium relaxes. Calcium contracts. 4. Quick clinical scenarios, interactive. Let's test your nurse brain. A patient has CKD and is lethargic, with low calcium and high phosphate. What would you check next? Hint: think about magnesium, PTH, and ECG. Got it? That's right. You'd check magnesium and ECG and anticipate possible tetany or arrhythmias. Always connect labs with patient symptoms. All right, future RNs, if you understand these concepts and their interactions, you'll never feel lost with electrolytes in your clinical practice. Remember, labs tell you numbers, but symptoms tell you the patient's story. Like, share, and subscribe for more deep nursing lessons. See you next time.